Back in the studio, though, we are cool. And it's time for our Ask the Vet Specialist segment, where we're talking about very common viral infection in cats. In fact, up to 96% of cats have been exposed to it in their lifetime, and that first exposure usually happens when they're kittens. Dr. Sonny Kuhn is here today, veterinarian ophthalmologist at Veterinary Specialists of Birmingham, and our regular guest, Dr. Jerome Williams, here from Red Mountain Animal Clinic. Good morning.
Good morning.
Good to see both of you. First of all, you have the most beautiful cat here.
Thank you.
Who is this?
This is Ghost.
Not up for adoption either,
Nope,
right?
Ghost
No.
is
So well behaved.
Very well behaved and
What a
only 1 year
beautiful
old.
cat. What is she?
He is Siamese, and he was adopted by one of the technicians at our practice.
Yeah.
His litter got turned in when they were 3 weeks old by a Good Samaritan.
Oh, wow.
And then she adopted him.
All
So,
right, well, he
he's a
sure
great
is
cat.
beautiful.
Yep,
okay, so what are
absolutely.
we talking about that most cats are exposed to?
It's called feline herpes, and it's a viral condition, and it's rampant in the cat population. Up to 96% of cats, like you said, have been exposed to it.
Wow.
And in 80% of cats, that virus will actually go dormant. It's sort of like a cat's version of a cold sore. The initial
like a fever blister.
Correct.
Yeah.
The initial infection that we'll see, they'll have upper respiratory signs, so a runny nose and sneezing and goopy eyes. And then that infection will pass, usually on its own, but sometimes on and off throughout their life. A lot of times, actually, these cats will chronically have things like squinting and tearing and flare-ups from their herpes that mostly manifest with eye problems, and that's when we see them at my work.
So now, because cats can be, a little, they don't get, most of them don't get in your face like a dog,
Sure.
and you're not really
Yep.
paying that close attention to them. But this is what you would see if you were
Yep,
looking in their
that's probably
face?
the most common manifestation of recurrent herpes, and that's just that mild squinting or that mild little bit of redness or puffiness. We call that conjunctivitis. Then that next picture there shows a little bit of corneal inflammation. We call that keratitis. Herpes is the #1 cause of corneal inflammation in cats. The main thing that makes it come out again, there's a picture of what we call dendritic ulcers. That's sort of your classic sign of herpes. And then
What does it do to their sight, their
and
vision?
so by itself like that, very minimal effects to vision, but if they get infected, if those ulcers get infected, then we can have a really big problem. And that
Okay.
infection comes from bacteria.
All right.
So things that will make herpes come out again is anything stressful for your cat. And it's kind of hard to know what's stressing your cat out or not. Things we know that can be stressful for them are new people or new animals within the household, a change in environment, illnesses, and then taking certain medications that suppress the immune system.
All right, so Dr. Williams, do you see this when you check a regular, you
We
see
saw
something's going
so
on?
many cases of it, and we can treat it more effectively because we have people like Dr. Kuhn who's advised us. And those difficult cases that we just can't seem to get a handle on, we refer to her, and they do a tremendous job in taking care of them.
So what do you do?
Sometimes we have to add on antivirals. Most of the time, herpes is a self-limiting infection, like a cold sore. It just runs its course, and then the infection will get suppressed again by your immune system. But every now and then, we'll get a challenging case, and we can start either a topical eye drop antiviral or an oral antiviral.
Now,
to
will
help.
someone like Dr. Williams always notice it, or can it go
A lot of times
undiagnosed?
it'll go undiagnosed, and you'll see your cat have a flare at home, and it'll last a day or two, and then it seems to go away.
You may not even see it,
Yep.
right?
Or it might just be, Fluffy had a squinty eye for a day, and then no big deal after that.
Okay, so as we wrap up, what advice for people who are watching may hear those numbers and be worried about that?
Well, one of the things I want folks to realize is this herpes is not transmissible to people. It's unrelated.
That's a good point.
Yeah, we get
When
that
you hear
question
that
a
term,
fair
when you hear
amount.
that term,
Yeah,
sure.
we do get that a fair
Yeah.
amount.
Another thing that we encounter is treating it as if it were a normal bacterial infection.
That's also true.
That does not respond.
Okay.
So then we have
Because
to.
it's a virus, so an antibiotic isn't really going to help with the virus.
Okay. All right. Well, it's just another reason to keep a close watch on our pets, right?
That's right,
Yeah.
absolutely.
And you're beautiful.
He's so good. Look
He's
at him
so
just sitting
good.
there.
Dr. Kuhn, Dr. Williams, thank you. Thank you both
Sure.
so much.
Thank
And
you.
thank you too, sweetheart.
Okay.
Beautiful. All right, now here's JJ.